solution to the UPLIFT Innovation Challenge was all about developing our digital offerings for patients. We'd already begun to develop podcasts for patients as a result of the COVID-19 pandemic, when all our face-to-face education events had to cease overnight. But what we wanted to do was really take that innovation to the next level by looking at providing webinars, but really interactive webinars, and also looking at further promoting our podcasts through paid advertising to make sure that we were reaching as wide a population as possible.
One of the gaps that we are facing here in the Philippines is that not every doctor is aware of psoriatic disease. So a lot of our members or a lot of patients living with psoriatic disease are either misdiagnosed, undiagnosed, or they really don't know what's happening in their body. And since the specialists is just few and not all of them are present in every corner of the Philippines or in any provinces, so that's the big gap. So what we decided to do is to create a platform where we can train local doctors that can be accessed anywhere in the Philippines, and that they can learn on their own time, on their own space, on their own pace.
Me and My Doctor is a project about the improvement of communication between healthcare providers and patients. The communication can be optimized throughout education, dialogue, and exchange of views. The doctors had the opportunity to talk with the patients and listen to their point of view. In this way, the patient's voice was stronger. On the same time, the patients realized the importance of the good communication, the importance of building a relationship of trust between the doctor and themselves. In this way, the patients can handle their disease better.
As a patient organization, we truly know that shared decision making is not just a slogan. It can be applied to the real world. So we are developing the patient decision aids right now and inviting the communication instructor to guide patients and healthcare providers on how to communicate well. We want to connect patients with dermatologists and rheumatologists more. In addition, the solutions give patients the voice of the healthcare systems. We want to set up structures and atmosphere that patients can reduce the gap and discuss health conditions more confidently and comfortable with healthcare providers.